Hello, and welcome to this Why Quit podcast, where we'll be discussing mental ill health and smoking cessation in early intervention services. I'm Joe Golden, working for the University of York in the Health Sciences, Mental Health and Addictions Research Department. I'm delighted to introduce to this podcast Professor Simon Gilbody, Director of the Mental Health and Addictions Research Group at the University of York. Former GP, Dr. David Shiers, Dr. Jackie Curtis, Lecturer and Clinical Director of Youth Mental Health in Sydney, Australia, and Professor Paul French, Clinical Lead for Early Psychosis Services across Greater Manchester.
Well, it's fantastic. So I've been massively keen on working with people in the early stage of psychosis for many years, last 20 years or so, and we've known over the last that amount of time that physical health care for people with early psychosis is just absolutely awful. We know that the physical health care that people get is really such a shame. That there's been a recognition that people die 20 years earlier for ages. We've known it for a long time. We've not done a great deal about it, despite us knowing it. There are some key things that we can do in order to impact on that massive health inequality. One is to help people in terms of reduction of weight or prevention of weight gain, and the other is around smoking cessation. Those are the two big hitters in terms of if we could do anything, those would give us the biggest impact overall. It coincided with some fantastic work. We've got Jackie from Australia who's introduced herself in a moment, and we've got Simon who's done a trial in this area about helping people stop smoking. It's how we now start to mobilise all the knowledge we've got to kind of build that into the wonderful early intervention in psychosis teams which we now have right across England, and see how we can kind of take that knowledge and embed it in services. And that's really the purpose of this afternoon. Jackie, do you want to say a little bit about yourself?
It's great to be here today, and it's an important meeting around smoking and first episode psychosis in young people. I'm a psychiatrist from Sydney, from Bondi, and I've been working in the physical health issues, trying to prevent the physical health issues that you put so well for probably the last 12, 15 years, trying to make a difference and actually implement services. So focusing on preventing antipsychotic induced weight gain, we've been really quite good at that, but not the actual smoking side of things. So visiting from far away.
Very good, and I've not travelled quite as far as Jackie, so I'm Simon Gilbody from the University of York. I've travelled across the Pennines to be here in Manchester today. So, and I'm here because, like Paul and like Jackie, I became increasingly aware of this very poor health, this large health gap, this health inequality that exists for people who use mental health services. And so I'm a psychiatrist by background, but I'm also a population scientist, so it's an odd combination. So I started looking at what the important population drivers of poor health might be, and the one that sticks out is smoking. So the prevalence of smoking amongst people who use mental health services 3, sometimes 4 times higher than the broader population. And whilst it's fallen in the general population, it seems to be going nowhere amongst people who use mental health services. So there's a health inequality that seems to be getting bigger over time. So I spent the last 10 years trying to think about how we might intervene to try and reduce the prevalence of smoking amongst people who use mental health services. We spent a lot of time thinking about what a feasible, realistic intervention might look like, and then we went and tested that in a number of hundreds of people. So we conducted a very large randomised controlled trial, and the results of that came out just last year, so it was really exciting. And we've shown that by thinking about what works for the general population and trying to make that and adapt it for people who use mental health services, we can increase the chances of people successfully quitting in the longer term. So you can double your chances of quitting if you use an intervention especially designed for people with mental ill health. And so that's really exciting. It's given us a glimmer of some sense of optimism for the first time in this area, and it's given us a starting point about how we might think about using such an intervention in range different sections of the population. So the people who took part in our trial often had longer established mental ill health. They've been using mental health services for a good number of years, on average 30 years, and very few people in the trial were the sorts of people that we're thinking about this afternoon. So younger people with their first contact with mental health services, their first episode of mental ill health. So we want to think this afternoon about how we take those things that we know work for the broader population of people who use mental health services, and how we might adapt them to just make sure that they fit the space, the needs for people, younger people. And so that's the challenge, and we're looking to do more research in this area and see how we can learn from what's been happening in Jackie's service and what we learned within our trial, and also thinking, in the room today with lots and lots of people who've got lots and lots of experience. So we're really excited about this afternoon.
And just to add my perspective, so I'm David Shiers. I'm really in the sense about as a carer, and I can relate to the people who've got established conditions, because my daughter now has had severe mental illness for 25 years. And I guess now as a parent, I worry about the extra illnesses that Mary accumulates compared to her brothers. She's already onto 4 conditions. And the thing that I'll never lose is the sort of neglect and the culture that Mary went into when she was first unwell, when she was 16, 17, and the culture of smoking. The culture also of eating and not doing no physical activity whatsoever. And so as an old GP, it really struck me that here was all the ingredients you've got to create huge trajectories towards poor health. I then got involved with the early intervention programme with Paul, so we were joint leads on programmes to deliver early intervention services. And like Paul, I shared that regret that we didn't actually do the body and mind bit. And then I met Jackie in a conference in Amsterdam in 2010. And the thing about like minds, so the same time that you were getting sort of worried about the downstream effects of smoking, Jackie and I were sort of thinking, well, this is something really obvious, that we should be tackling people's physical well-being really, really early on. And that was my experience as a carer, that don't just leave it and leave it and leave it. And so today, Jackie and I have done loads of stuff collaborating on various resources. And Jackie, we'll have to just show you the YQuit resource. We have proudly nicked from our Bondi colleagues, because they're busy nicking stuff from us. And actually this is about how you share and grow together. So there's a huge amount of experience and understanding and like a willingness to be together and sort of tackle these issues because of the rights, because of the social justice issue here. So that's sort of why I'm here, really.
So the afternoon is all about a workshop. We've got international experts in this. We've got some people who work in services across the north of England. I looked at the delegate list. This is certainly not just a group of people from Manchester, right across the north of England. And we absolutely want to work with these guys to collaborate, to think what are we going to do collectively in order to tackle some of these health inequalities. And that's the focus of this evening.
Yeah.
And the best research happens in the north of England, so we're all professional.
Absolutely. Perfect.
This podcast took place in Manchester at the Greater Manchester Fire and Rescue Service Training Centre on the 18th of July 2019 and saw the collaboration of the Equally Well organisation, the Closing the Gap Network, the Scimitar Study, the University of York and YQuit for an event focusing on mental ill health and smoking cessation.